What I think is really special about Rich Yochum is that he makes the extra effort to do what's right. It's really easy just to do what everybody else does, but it's really hard to bring it all together to do the right thing. And that takes a lot of business skill, and that takes a lot of compassion.
I think that Rich is the one that has fostered the culture of excellence. The idea that we need to provide excellent care to everyone that comes through our doors. He has a real heart for the underprivileged. He really cares very much for the people that cannot afford health care.
With Richard, it's not a 9-to-5 job. At 5 o'clock, he doesn't go home and leave the hospital behind. He really cares about what the hospital is doing, how it's doing, its doctors, its nurses, the thousands of associates that we have, the members of the board, and most importantly, the kind of patient care that we provide at Pomona.
Rich Yochum swoops in like an angel at strategic points. If Rich wasn't here, a lot of my ideas wouldn't have been implemented because he really gets it very quickly, and he lends his support loudly, and it all falls into place.
He is passionate about making sure that if it's available to anyone, anywhere, our patients from our community should have it available to them too.
He constantly says, over and over, it's not the last 100 years that are important. It's making sure the next 100 years, this hospital is here, providing the finest care possible.
A culture that starts at the top.
What's unique about our culture at Pomona Valley Hospital, I think, is first of all, the 110 years of having a very genuine mission, and we live that mission.
We all feel that we're a part of a bigger thing, a bigger organization. It isn't made up of 1 or 2 individuals. It's everybody pulling together.
53% of our employees, 3,000 employees plus, have been at the hospital for more than 10 years. And I think that's because they believe that we truly live our mission and we make a difference.
There is this can-do attitude that the whole staff has that is very difficult to find in healthcare.
We're not there just to take care of those who have the wherewithal to get any care anywhere. We are there to provide medical care for our entire community.
A mission shared with the National Health Foundation.
NHF has done many things and is currently doing many things, primarily directed at providing access to quality healthcare services for the underserved and providing the gaps in healthcare that are not provided today. When we have people that are homeless, they've had their care and treatment, their acute health care is no longer necessary, trying to place them is very difficult. And so NHF has come up with a recuperative care program and funded programs throughout the county of LA and Orange County that provide housing, provide the aftercare, and also help in social services for people that need continuing care and actually provide them, give them an opportunity to go back into a productive part of society. So I think that's an outstanding program that they provide. And the passion, which is kind of interesting, was really to provide access and quality delivery of healthcare services for the underserved. And that kind of fits real nicely with Pomona Valley Hospital's mission and value in terms of what we stand for. And so it fit very nicely for us, and that's why we've supported them all these many years. The county health system has always threatened that they were going to close the community health clinics. And we had the Pomona Community Clinic that was run by the County of Los Angeles. We decided at that time that that was not in the best interest of our community, that there were thousands of patients who needed access. They were underserved. They would have ended up in the emergency room, and our emergency room was overtaxed already. So we believed that the best thing to do was to bring together partners. We called it the Pomona Clinic Coalition in our community. We brought together other partners, and we, as the hospital, the lead agency working with the County of Los Angeles, took over the operation of the Pomona Community Clinic.
Rich was smart enough to go out and find the funding to care for everybody in the community.
And it's evolved now to what I think is an amazingly state-of-the-art community clinic for the care of not just the underserved, but all types of patients from all different walks of life. This is an opportunity to showcase an organization like Pomona Valley Hospital Medical Center that makes a difference, and makes a difference in providing access, meeting gaps in health care, providing, again, access to health care for the underserved that otherwise would not receive the quality and the level of health care that they do. And I want to thank everyone for being party to this tonight and supporting us and supporting the efforts of the National Health Foundation.